featuring, which is called Heraux. And when I talk about anti-aging to patients, I tell them that there are there are a few types of, well, I give them the caveat that, these types of anti-aging molecules that really work are typically at a higher price point. They're usually a few $100s. And if you are going to spend a few $100s on a skincare product, my advice is to spend it on research and development, efficacy, clinical trials, not on marketing and branding. And so there's a few different recommendations that I usually give people where if you're going to spend that, if you're going to go for something in that price point, I usually have kind of a short list of things that I recommend that I know have clinical studies that I know show in, usually very small studies that there's improvement in fine lines, that maybe they do some histologic studies where they show some increased collagen and elastic fibers. As you age, your skin has collagen that starts to fray and break down, and your fibroblasts, your collagen producing cells, they start to produce less and less collagen. And there's sort of like this vicious cycle where broken down collagen causes fibroblasts to kind of lose their momentum. And it's a feedback loop. And so whenever we do a skincare treatment in the office, like a laser, the idea is to create kind of focused damage that stimulates the fibroblasts to create new collagen. Christy asked if collagen gummies actually work. It appears that they do. My favorite is in my group of favorite products that I put on Verishop, which is the Vital Proteins collagen. But there is some evidence that those are helpful, yeah, and we'll get into that, probably another week. But things that we do in the office are in order to stimulate fibroblasts. So that's what all of these things are doing. Heraux is what I would call like a novel anti-aging molecule. Often anti-aging molecules will be peptides that stimulate collagen production or growth factors that stimulate collagen production. And Heraux is a new molecule, which is a lipid. It's called HX1, which is why they call it Heraux. And HX1 apparently was created during with rheumatologic or joint research, and it was isolated as something that protects stem cells from inflammation. And so whenever you have like an injury or cellular stress, you get inflammation where your body has kind of chemical transmitters that stimulate your immune system to ramp up. And so these inflammatory molecules can be counterproductive sometimes. They may help in certain situations, but then they kind of get a little out of control. And so HX1 was a molecule that they found that can protect the stem cells and therefore protect the skin's regenerative ability to heal from sun damage, environmental exposure, and that sort of thing. So I kind of, took notes for myself on the study. They have, a small clinical trial that shows that after 4 weeks of using this product twice a day, they saw that there was increased smoothness of lines, clarity of the skin, that improved over over 4 weeks of usage, and then even more improvement over 8 weeks of usage. So that probably they didn't, as far as I know, do histologic studies showing that there was an increase in collagen and elastic fibers. But if they noticed those changes, then that's probably what is occurring in the skin. And I like this because it has some other stuff, and it has vitamin C and vitamin E, which are two antioxidants. So it's another way of preventing cellular stress, and then has some hyaluronic acid, which is moisturizing. So those are sort of the three products I wanted to highlight and sort of my overview of skincare. I'm happy to answer any other questions. Otherwise, I could just kind of go on about different other actives, and that's, I guess, what I'll do until I see some questions pop up. So, a lot of people ask what order they should be using their skincare, and typically you want to do medicated or actives closer to the skin after cleansing, and then more thicker layers as you go up. So you want to start with a cleanser, and then when you have a clean slate, then you want to put on any medications that your dermatologist recommends, because you want to make sure that those get the best absorption. If you are, DIYing it, then you'll want to put any serums that you want to use. So let's say you want to treat your acne and you're not ready to come in and talk to a professional. Things that you might look for in various serums are niacinamide, zinc, retinol, glycolic acid, salicylic acid. Thank you, Erin. I appreciate that. Erin says that's the best explanation she's ever heard of the order of using skincare. I appreciate that. So you get your actives on, and then you cover them with, various layers of protection. Moisturizer to add a little layer of protection to prevent transepidermal water loss, and then sunscreen to add a protection from UV, and then makeup to, add a little more opacity. So let's say you're oily, you might want to choose actives that have niacinamide, which has been shown to reduce sebaceous gland activity, your skin's oil glands. Astringents like witch hazel can sort of dry out and mattify the skin. Silicones also, I find, have a very mattifying appearance, and that's what I really like about the Supergoop sunscreens, the matte screen and the unseen sunscreen. They have a very matte silicone-y appearance, which is really nice. Silicones are safe, and they feel really nice. If you have dry skin, you might want to use serums that have humectants in them. So most serums are not going to have as much occlusive moisturizers in them, because the whole point of the serum is to be super lightweight and absorptive. But you might use a serum with hyaluronic acid, lactic acid, honey. Some serums are oil-based, and so they will add a thin layer of oil, which protects the skin from water loss and also kind of gives you a nice kind of sheen. Do I recommend letting SPF set before applying makeup? I would let SPF set. You want to make sure that you put it on, you let it sort of form an even layer on your skin, and then you can put makeup on top of it. The Supergoop sunscreens, because they have that silicone base, that's what primers are, essentially. A primer, a makeup primer that smooths out your pores, is just a silicone-based vehicle that sort of gives you like this kind of smooth, sort of slippery layer that sort of like blends your pores. And so the Supergoop ones that are silicone-based, they act like a primer. So I think it's, in men where you're not, or in women where you're not going to wear makeup, it sort of smooths things out, gives you kind of a mattified appearance, gives you a little bit of color with the matte screen. And then if you are going to wear makeup, it acts as a nice primer. The maximum SPF that actually works, well, that's a great question. It's diminishing returns. Even 15 SPF gives you a lot of coverage, something like 90 something percent coverage. 50 gives you more, 97%. And each one from there, as you go up, gets less and less and less. I think 50 is great. I think 30 is perfectly fine also. So I think as long as it's 30 or higher, it works. The most important thing is how much you apply. There was a viral kind of video with Gwyneth Paltrow just kind of like just kind of applying just a little bit to her contours and, you know, almost as like a contour or makeup, but that's not really how you want to do it. You want to make sure you get kind of full coverage of your sunscreen. Some people apply it twice, and then you have to reapply it over time. You know, that nice smooth layer of sunscreen will sort of clump a little bit. If you're going to be doing sports or at the beach or something like that, then you're going to get it washed off much faster. So a lot of the SPF, you know, is lost. You have to make sure that you're applying enough of it to even get to the listed SPF in the bottle. But I think 30 is fine, 50 is better, 40 is perfect. So yes. How about rosacea prone skin? I have rosacea prone skin. It's hard. You want to make sure that, you know, I think retinols can be a little too irritating for rosacea. If you're going to use it, use really gentle ones that, you know, have a lot of moisturizer in them. You might want to sandwich it with moisturizer where you put a layer of moisturizer, then retinol, then more moisturizer. Other things for rosacea, you know, I think there are certain actives that can be helpful for anti-inflammatory benefit. I find sulfur and sulfur washes and soaps really helpful for rosacea. Zinc, niacinamide is also helpful for redness. So that, yes, those are tips for rosacea. Jessica asked, does SPF over 30 matter? Is it really better or the same? It's really the same. I think anything over 30 is perfectly fine. I think once you get to that level, it's really more about how you're applying it. You know, if you are applying it exactly the same way, 50 would give you slightly better coverage than 30. But if you are going to be somebody who applies it with a good thick layer over the whole face, and you're going to reapply every couple hours with 30, and you're not going to do that with 50, then it's not going to be worse. It's going to be better. So it's really about how you apply it once you get to that level. And you just want to find a product that you like to wear. I mean, I never wore sunscreen in the morning, even as a dermatologist, because I just hated putting it on. But now I like putting it on. So, you know, as long as it's something that you like, that's the most important thing. Finally, you know, some other kind of like anti-aging ingredients that you might want to look for in serums, especially, you know, as you get to your 30s or 40s, you might want to look for vitamin C, which is going to help reverse and protect from sun damage. Retinols, for sure, that's a huge, you know, important anti-aging molecule that really works. You look for products that have collagen stimulating peptides. Again, look for products that a dermatologist recommends or that has good, you know, trials behind it, something with growth factors, or something, you know, like Heraux with a novel anti-aging molecule, but still has, you know, some good research behind it. Let's see. I think, you know, I think we're pretty much toward the end. I really, you know, appreciated the opportunity. It's nice to teach about this. I'm excited, you know, for the next few weeks to come. So thank you, everybody. I'm on Instagram if you have any questions. All right, bye.